Hello, I am part of the discussion group that is giving the negative effects, I guess, of management of diabetes, heart disease, and other chronic diseases with the treatment of omega-3 fatty acids. Some of the research I've come across from the National Institute of Health, um, they've dealt with epidemiological studies done over 30 years ago that relates, kind of how low death rates due to cardiovascular disease existed in Eskimo populations with high seafood consumption. Uh, there's been tons and tons of research done since then on the effects of omega-3s and seafood and supplements and EPA and DHA and things of that matter. I think they were kind of going on circumstantial evidence at that point, cause and effect issues between those populations of Eskimos and their cardiovascular disease deaths. But they have done several studies through the NIH, and they've evaluated the effects of supplements more or less than really eating seafood. So they're basing their evidence on fish oil supplements, EPA and DHA, on heart disease risks. In those studies, they've compared a number of cardiovascular events, such as heart attacks or strokes, or the number of deaths in people who were given supplements uh, with those in people who were given inactive supplements, such as placebos and or had standard care. Um, there were some studies that also involved people that had evidence of heart disease and also without an evidence of heart disease. Um, as with most studies that I've found, there was a lot of inconsistent evidence with these studies. Some indicated that the supplements were protective against cardiovascular disease or cardiovascular events, and some decided that they were not. In 2012, there were two groups of scientists who also did a meta-analysis of these studies. One group focused mainly on those who had heart disease, and the other group of scientists focused on the people who had both heart disease and without heart disease. Neither meta-analysis found any convincing evidence that showed any protective effects of having the fish oil supplements, omega-3 fatty acids. Um, there are several reasons why supplements that contain EPA and DHA may not help to prevent heart disease, even though a diet rich in seafood may. Basically, their conclusion on this was the fact that they're seeing that people who eat seafood a few times a week, they're getting their omega-3s from that, and they believe that these people in general have a healthier diet as well as a healthier lifestyle. So that might correlate with why they see an increase, or I guess I should say a decrease, in cardiovascular issues. Um, Another research article I found through the American Journal of Clinical Nutrition kind of goes through the effects of type 2 diabetes and what it comes from as far as it being strongly associated with pro-inflammatory products of obese tissue. And it's been established that insulin resistance results from inflammation of the adipose tissue, in which the cytokines such as tumor necrosis factor, interleukins 1 beta, and interleukin 6, as well as plasminogen activator inhibitor 1, are part of the development and progression of type 2 diabetes. Um, with regards to omega-3 fatty acids being beneficial and able to prevent type 2 diabetes because they have a potential of suppressing these pro-inflammatory products in the adipose tissue. So they're kind of saying that by taking these omega-3s, it should prevent those pro-inflammatories and reduce evidence of type 2 diabetes. Um, so in their opinion, they're saying that with the research that they've looked at, that high doses of these polyunsaturated fatty acids from the omega-3s um, are more susceptible to oxidation if there's lack of antioxidants in the diet. So people who are taking these high doses of omega-3 fatty acids are creating more creating more toxins and oxidates in their cells, and if they're not eating enough antioxidants, it's correlating to an increase in pro-inflammatory products, and I guess they're saying it leads to a result of more type 2 diabetes in that aspect. Um, they also did one dietary supplementation with high concentrations of omega-3 fatty acids in patients with atherosclerotic heart disease for 6 months, and it did not reduce the incidence of restenosis, but actually had a negative effect on that. A little other evidence I found from Medline. This talks about diabetes. There's a concern on here that taking doses or high doses of fish oil may make the control of blood sugar more difficult. Other studies have shown that fish oil has increased blood sugar, and there's been blood sugar spikes, which has led to other issues later on in life with concerns with diabetes. As far as blood pressure goes, fish oil can lower blood pressure. For people that are already being treated for blood pressure, low blood pressure, and blood pressure medications, they kind of interact with each other and can cause a little hypotension. Um, as far as people with AIDS or HIV or lowered immune systems for any other reason, they're also saying that high doses of fish oil can lower the body's immune system response. So it negatively affects people who may be on any type of um, antiretrovirals, anything like that for HIV and AIDS. Um, there's certainly, I guess, more research that shows that there's positive effects related with triglyceride levels and other levels of that nature, but there's a few negative effects that should be taken into consideration. Maybe more research and stuff needs to be done. Um, I personally take, EPA and DHA and things like that myself, but there seems to be a little bit more good involved, I guess, than negative effects with these things. But that's why we'll keep doing research and see what happens. Thanks.